Okay, now you've made the decision that you're going to have surgery. You understand the anatomy, you understand the surgical treatment. Now we have to go through the details of what it takes to be prepared for a successful surgery. And I require patients to follow a certain pathway to get ready for surgery. First, you have to understand your injury. Well, by now, hopefully you do. Second, you've got to get yourself in the best physical shape that you can in preparation for healing from the surgery. And third, you've got to prepare your home in order to have everything ready for the first 6 weeks after surgery when you're going to be in a sling and you're not able to use your arm as you're used to using it for your activities of daily living. This is a bigger problem than most patients understand. And in my opinion, the most important part of getting ready for surgery is getting ready for after surgery. The physical therapy, the sling, all of the things that I require for patients after surgery are essential for the success of the surgery. So I'm going to talk a little bit about what you need to do to get ready for after surgery. My surgery scheduler makes sure that you're ready for the surgery and follows a very detailed checklist. But the thing that I see over and over again with patients is that after surgery it's a little confusing. There may be discomfort, you may not remember what was told to you, and yet you have to manage, sometimes on your own, in your own home, your activities of daily living. The first thing I must tell you is that for most patients who have a rotator cuff repair, the sling is to be worn at all times for the first 4 to 6 weeks. I'm going to repeat this many, many times to you. The sling must be worn at all times in the first 4 to 6 weeks. The question is, well, do I have to wear it at night? How about in the bathroom? The only time that I give you permission to take your arm out of the sling is when you're taking a shower. You can let your arm hang by the side, or if you're doing the required exercises, which we'll be talking about in our next segment. So the sling, it's to be worn all the time for 4 to 6 weeks unless I specifically tell you otherwise. I think I've told you that enough times by now. The second thing is that there are required exercises that you need to do starting the very first day after surgery. And they are so simple that when you're not having shoulder pain, most people decide, I know these exercises, they're not difficult. I'm going to emphasize that they may be simple, but after surgery, you may not remember how to do them properly. Because this has been such a problem, for most patients, I send you to the physical therapist the week before surgery so that you can rehearse these and that you have them memorized so that you don't have to think about them when you may have discomfort or may be on pain meds. I call this pre-habilitation. You go to the therapist when you are not in the discomfort after surgery and you rehearse these exercises. The most important thing to understand about choosing surgery is actually not the surgery. It's the time commitment to recover from the surgery. In every patient who has a rotator cuff tear, it takes 4 to 6 months for the tendon to heal back to bone and become strong enough to return to normal function. No matter what you do, the biology of the shoulder takes 4 to 6 months for the tendon to heal and to be safe to return to normal activities. Now, I have many patients who think they are going to be fast healers. These are the patients I worry about, because when the tendon is not healed and you overstress it, we end up back in the OR re-repairing it. Now, fortunately, most patients believe me when I tell them that they can hurt themselves if they do too much. I have had very few patients who needed to have re-operations for that reason. So let's talk about the healing period, which I consider to be the most important. We've already talked about the first phase, and there are 3 phases named phase 1, 2, and 3. Phase 1 is the protected motion period. You're in a sling for 4 to 6 weeks. You've heard this now 10 times, but I am serious. In 4 to 6 weeks, if you stay in your sling, your tendon will have had enough healing that we can start phase 2. Phase 2 is where you get to recover your motion. This is when most patients get happy because I've taken them out of the sling, and at this point they start to feel more normal, there's less pain, and they're able to use their arm in a more normal fashion. Now, phase 2 can take between 6 and 12 weeks depending on how stiff your shoulder has become. Phase 3, which is the final phase, is where you get to start strengthening the shoulder. Now, for the reasons that we've just talked about, we delay starting phase 3 and putting the stress of strengthening on the tendon until you are 3 months after surgery. No matter how the surgery is done, no matter how fast a healer you are, the tendon has to have enough attachment to bone to withstand the strengthening, and this does not happen before 3 months. Once you start phase 3, most patients do not see me very often because they are progressing very well. Somewhere in the 4 to 6 month mark, we release you from care, and hopefully you'll continue your strengthening and continue to protect your shoulder by doing exercises that keep the motion and keep the strength at a normal level. If you understand this part about getting ready for surgery, you will understand what I consider to be the essential part of the surgical commitment, which is the time it takes to recover from surgery.